Last night, lawmakers were at their desks well after dark, racing to pass dozens of bills before a key legislative deadline known as Crossover Day.
Happy Crossover Day. I just hope you'll be happy at the end of the day.
Some lawmakers were happy.
Thank you, Mr. President, colleagues. I am honored.
Others were frustrated and even angry.
I don't know. I'm definitely very disappointed. I think it's a missed opportunity.
Also this week, a massive school safety bill advanced out of the House.
Rarely in this chamber do we get the opportunity to save lives. This bill gives you the opportunity to save lives.
We'll also look at the shift in the debate on bills focused on transgender Georgians.
And later, we'll take a deep dive into turmoil at the Centers for Disease Control and Prevention with health reporter Jess Mador. I'm WABE politics reporter Sam Gringlas.
I'm WABE politics reporter Rahul Bali, and this is Plugged In from WABE.
Rahul, talk to me about a few bills that passed just in the nick of time, right before this critical deadline for bills to clear at least one chamber of the legislature.
Well, Sam, the House and Senate adjourned a few minutes ago after debating and voting on dozens of bills. I wanted to start with a debate that really got my attention. The Senate took up a bill that would expand the state's medical cannabis program. Senate Bill 220's proposed changes include raising the THC limit for products from 5% to 50%. Also, allowing the vaping of medical cannabis products, which allows a faster effect for certain conditions like epilepsy. Finally, SB 220 also expands the list of eligible conditions on the low THC registry to include lupus, all inflammatory bowel diseases, along with removing the need for some diseases to be in their end stage. But what was notable was the at times tense and emotional debate in the state Senate. Here's Republican State Senator Ed Setzler, who opposed the bill.
The kind of concentrations of THC that we're proposing this bill has a big effect on our nation. It's not a victimless crime. Not only does it make people dumber, that's proven in research. Even the proponents of this bill would recognize the idea of motivation and zeal and energy of people who are regular users of marijuana is lowered.
The bill's sponsor, Republican State Senator Matt Brass, pushed back on those who claimed that this would lead to recreational marijuana use or abuse of the state's low THC program.
What separates us from other states that went the way of recreational, and it even separates us from medical marijuana states like Florida, is we did two things that they failed to do. We got hold of our list of diagnoses, and we got a tight grip around the amount of licenses that we put out there.
Senate Bill 220 passed 39-17 with all Democrats and some Republicans voting for it. All the no votes were Republican. The bill now goes to the state House.
Okay, we'll name a few bills that did not survive Crossover Day, with the caveat, of course, that bills can get life later on if they're inserted into the text of another bill that did make the deadline.
So, Sam, we've been covering the stories of Georgians who were wrongly convicted, jailed, and then exonerated. The issue here at the state capitol is how to compensate them for their time in jail. The current process involves individual pieces of legislation for each person, which includes a compensation amount. There are 5 of those this year, and they were passed as a group on Crossover Day. There's also a bipartisan proposal to replace the current system with a new process that includes a state administrative law judge reviewing evidence with a burden of proving innocence. It also sets a compensation for $75,000 for each year in prison. That did not get a vote in the House. I spoke with a very frustrated Democratic State Representative Scott Holcomb, who's been working on this issue for a few years.
I'm very grateful that the individual resolutions moved, but I don't understand why the House didn't continue to work on what everybody recognizes is a needed fix, which is to adjust the way that we compensate the wrongfully convicted. So I'm both a mixture of angry and disappointed, to be really candid.
Now, Holcomb's co-sponsor, Republican State Representative Katie Dempsey, is hoping they can find another bill that has already passed out of one of the chambers to attach House Bill 533 to, that will give them the option to get it done this year. And Sam, this is where I remind people of a couple of things. There is that option of attaching the bill to another bill that's in the same code section. The other reminder, the Georgia General Assembly is a 2-year term, so any legislation that doesn't make it this year can be passed next year.
Let's dig more deeply into one of the bills that you've been following and had kind of been an open question whether it would pass, and that's a push to legalize online sports betting. Where did this land?
So the most notable legislation to expand gambling did not get a vote in the House. House Bill 686 and House Resolution 450 would allow for a voter referendum to amend Georgia's constitution and allow mobile sports betting. I spoke with the bill's lead sponsor, Republican State Representative Marcus Wiedauer, moments after the final gavel fell.
Obviously disappointed. I think it was a good measure and the right thing to allow Georgians to make the final decision on whether or not they wanted to legalize sports betting. And just didn't make it to the floor.
Wiedauer then told me he's going to go home and think about his next steps next week.
All right, I want to talk now about a debate that caught my attention this week when the Senate advanced a bill to prohibit state resources from being used to provide gender-affirming treatments to state prison inmates. Something really surprising happened. Several Democrats voted yes. When Democrat Sonia Halpern went to the well, she criticized Republicans for framing the issue as a crisis, but she didn't stop there.
There is no policy urgency on this issue. But I am also a pragmatist, and the simple truth is that I cannot, in good conscience, support taxpayer-funded medical procedures for prisoners that we do not provide to law-abiding citizens who are struggling every day to afford basic health care.
Halpern joined Republicans and 3 other Democrats voting for the ban. Among them, Democrat Elena Parent, who has forcefully opposed other bills focused on transgender Georgians, including earlier that day. 4 other Democrats did not vote. Now, some Democrats say they're voting the will of their constituents or draw distinctions between this bill and others focused on trans Georgians. But the votes also come as Republicans have been using the issue to attack Democrats, including during the 2024 election. Here's Republican Senator John Albers.
If you support sex-change drugs and surgeries with taxpayer dollars for convicted criminals, I really believe you've lost touch with your constituents and your grip on reality.
But many Democrats, like Senator Josh McLaurin, still believe that Democrats voting yes on these Republican-backed bills is the wrong approach.
By playing along with the idea that these bills have merit individually, we are covering up what's actually happened. It's very, very simple. There is a vulnerable group of people who don't have a lot of political power. There have been a couple trial balloons on electoral success by beating up on them with bills, and now we're off to the races.
This session, Senate Republicans have approved at least 4 bills focused on transgender Georgians, including this week a measure that would ban providing puberty blockers to minors experiencing gender dysphoria. That bill heads next to the House, where its future is unclear.
So, Sam, let's get to another long debate here at the Capitol this week. The House voted to advance a hefty package on school safety following the deadly shooting at Appalachia High School. And some of the provisions were controversial. How did this debate unfold, Sam?
Speaker John Burns called HB 268 the session's most important bill, saying lawmakers have a sacred obligation to protect Georgia's children. Republican Chris Irwin, who we heard from at the very beginning of the show, chairs the Education Committee and said this bill will save lives. Now, here's what it does. It requires school districts promptly transfer records for new students. It creates behavioral health threat assessment teams and requires districts to hire a mental health coordinator. It also requires districts deploy an app for anonymously reporting potential threats, and it mandates counseling and suspension for students that make credible threats. The most complicated and controversial provision is a new statewide system for sharing data about individual student behavior, discipline, and other information between schools and different state agencies. Some lawmakers, like Democrat Makia McQueen, a teacher, worry about privacy and profiling.
I see the amendments. I see the attempt to build in some guardrails. But colleagues, there is so much more work to do.
While most Democrats voted in favor of the bill, many, like Lisa Campbell, expressed dismay about what the bill did not address.
Out of 65 pages, the number of times a gun or guns is mentioned is 0.
Separately, the House moved to create a tax incentive encouraging safe firearms storage. Both bills passed overwhelmingly and head next to the Senate.
So let's take a break. This is Plugged In from WABE.
This is Plugged In from WABE. On a sprawling campus in Northeast Atlanta, more than 10,000 employees at the Centers for Disease Control and Prevention work every day to safeguard public health.
But that work has come under fire as President Donald Trump and Tesla CEO Elon Musk have moved swiftly to fire employees, slash programs, and funding across the federal government.
Democratic State Representative Syra Draper spoke at a protest at the state capitol. The CDC is located just outside her district.
Make no bones about it, the way this is taking place is unnecessarily cruel, unnecessarily chaotic, and unnecessarily reckless.
While Democrats have expressed alarm, most Republicans, like Representatives Marjorie Taylor Greene and Mike Collins, have defended the cuts.
Taxpayers are $36 trillion in debt. You yourself are $36 trillion in debt. These are necessary cuts that have to be made, or we're all going to be a sinking ship.
WABE Health Reporter Jess Mador has been reporting on the turmoil at the CDC and a number of other emerging public health developments. She joins us now. Jess, welcome to the show.
Hi, thanks for having me.
All right, I want to start with the CDC. There have already been a lot of ramifications with Trump's efforts to drastically reduce the footprint of the federal government. These changes are being felt at the Atlanta VA and other federal agencies, but the CDC is really a unique Atlanta institution. So Jess, first remind us about the scope of the CDC's work and what it does from its headquarters here in Atlanta.
Well, the U.S. Centers for Disease Control and Prevention is the nation's top public health agency. It studies, tracks, alerts about disease outbreaks, chronic diseases too, like diabetes, and it also issues guidance, like for when we should be vaccinated against COVID-19 and the flu, and it's got a budget of around $9 billion. Much of the funding that the CDC gets from Washington goes right out to states and local public health.
Hey, Jess, what do we know about the number of Atlanta-based employees that have been affected by the layoffs?
It's a really fluid situation still. We don't have precise numbers, and we know that firings have continued. What we do know is that, the Trump administration started by firing employees across all federal agencies it considers tied to diversity, equity, and inclusion efforts, DEI. Since then, over the last few weeks, there's been a whole flurry of orders. We've had a round that offered essentially these voluntary resignations to all federal agency workers. And after that, it fired thousands of what are called probationary employees. And these are not just newer staff at the CDC and other federal agencies. These are also people at very high levels at the CDC. So people who have just moved between CDC departments or gotten a promotion, they're also considered probationary.
Jess, you've been speaking with both current and now former CDC employees and also staking out protests that have been going on outside the CDC campus. Can you tell us about some of the employees that you've been talking to?
I've been talking to a lot of people at the CDC, former employees, current employees, and federal workers at other agencies who are based here in Atlanta. And, most are just afraid. They're terrified about what's going to happen next. And the string of emails that has been coming is just, really sowing confusion and anxiety. Most of the people I've been speaking with, if they're still working at the CDC, they're requesting anonymity because they're not authorized to speak publicly and they're afraid. One person I met who was fired a couple weeks ago, his name's Ryan Sloan. Here he is at a rally at a union building near downtown Atlanta.
And I'm only here today because they cannot fire me twice. The people that are still working in government are terrified about what comes next. They are terrified for their jobs. They are terrified that their life's work is going to be deleted from servers. I am going to fight tooth and nail every single day to make sure I get my job back and everyone else gets their job back. It is extremely disheartening and disappointing that a job that I worked so hard to get, an 8-month hiring and vetting process for a job I got to hold for 7 weeks before I was fired by an anonymous email at 9 p.m. in the middle of a holiday weekend.
Jess, we saw all the stories about certain CDC websites going dark, bans on using certain words like health equity or health disparities. We saw the FDA vaccine advisory panels being canceled. What are some of the CDC programs that have been affected, and how will this affect public health, especially, for example, the outbreaks of bird flu and measles?
I can give you some examples of some of the teams that have already been cut. So a couple of really important fellowship programs, the Public Health Associate Program for recent graduates. We've got something called the Laboratory Leadership Service, or LLS, and that, trains public health staff to do testing and assist governments and others with outbreak response, so emergencies. We've got the Presidential Management Fellows Program. That was actually created by President Jimmy Carter in the 70s. That's for people with advanced degrees and expertise to work with the government and at the CDC to become public health leaders, scientists who detect and respond to disease outbreaks and monitor for threats like COVID-19 and bird flu. And, it's important to keep in mind that hundreds of other, scientists, public health experts have already been fired from the National Institutes of Health, the FDA, USDA, and other agencies that also coordinate with the CDC on health threats. So the concern is that the country, the agency, is going to lose expertise and see a brain drain and see its ability to attract, recruit, develop, new talent to be the future of public health, that will all be weakened under these cuts.
So last week, every Republican in Georgia's congressional delegation voted to advance a budget blueprint that could result in Medicaid funding being slashed by billions of dollars. The budget plan calls for up to $4.5 trillion in tax cuts and $2 trillion in spending cuts over a decade. The Energy and Commerce Committee, which oversees Medicare and Medicaid, is responsible for finding $880 billion worth of those cuts, which would likely have to come from Medicaid. Jess, tell me what this could mean for Georgia if these Medicaid cuts become reality.
There's no way around just saying that Medicaid cuts, even changes to the way the financing is done, is a really big deal for all states, including Georgia. And as a reminder, Medicaid is a program that's jointly financed by the federal government and all states, right? In Georgia, we've got around 2 million people in the program, and it does a lot more than just insurance, but everyone in Medicaid in Georgia is extremely low income, and most of them are children. There are seniors, people with disabilities, people who need long-term care, people who are pregnant and low income, and Governor Kemp has expanded that to include women up to 1 year postpartum. And, 3 in 10 people on Medicaid in Georgia are people with disabilities. It also provides critical hospital and clinic funding. Advocates are really worried that big Medicaid cuts, changes to the way the money comes to states, would just widen Georgia's healthcare gap. The state already has one of the highest uninsured rates in the U.S., and hospitals, especially in rural areas where we already have almost 20 at risk of closure, will be at even greater risk.
So, Sam, what about the politics of the federal budget and Medicaid?
Okay, so I think you're seeing two reactions within the Republican Party. There are folks like Republican Representative Barry Loudermilk of Georgia, who called the plan a bold budget initiative that brings back fiscal sanity. But then you've also seen some Republicans who have expressed at least discomfort with cutting Medicaid in this way, like Representative Rich McCormick, who got blasted at a town hall last month. But in the end, all Georgia Republicans voted to advance this budget blueprint, which I should point out still needs Senate approval.
But it does seem like Democrats in Congress may be pushing back a little bit harder now. Just the other day, we had Congresswoman Nikema Williams, who held a rally in Atlanta, and, she highlighted the fear among public health experts that firing scientists and public health experts will hamper the nation's ability to respond to disease threats and ultimately hurt the nation's ability to discover new cures and new treatments for diseases that already exist.
We just came out of a global pandemic, y'all. And I think about all of the children. My son started kindergarten during COVID in 2020. But it's because of the work of the CDC and the NIH and making sure that we could get vaccines out in arms, making sure that we could continue to research so that we could keep our community safe, that children were able to go back to school, that people were able to go back to work and get our country back on track. But now all of that is being cut.
Now, on the Republican side, I talked to Representatives Marjorie Taylor Greene and Mike Collins during their recent visits to the state capitol.
And I can assure you there are plenty of jobs right here in the state of Georgia that folks can go get a job, especially those people at CDC. They could go to any hospital around this state and get a job pretty quick if they are a good employee.
Now, at the beginning of the segment, you heard from Congresswoman Marjorie Taylor Greene mentioning the size of government and the national debt as reasons to cut government. I also asked her about how these cuts are happening. For example, the cutting of probationary employees.
So many times employees and workers of private companies lose their jobs based on government decisions. When President Biden came in, he wiped out the Keystone Pipeline. 11,000 workers lost their jobs.
Now, it's not just Republicans who are completely in the Trump camp behind this. Governor Brian Kemp was asked about the CDC cuts by a reporter recently, and he said, quote, "Government can stand a little right-sizing," unquote.
Politics aside, any big changes coming from the federal government on the way Medicaid is funded for states is likely to have big impacts here in Georgia and in other states.
WAB Health Reporter Jess Mador, thanks for your reporting.
Thanks for having me.
And that's it for this edition of Plugged In from WABE.
Plugged In is available wherever you want to listen. If you listen on demand, make sure to head on over to the Plugged In feed to subscribe, leave us a rating, and a review. You can also now find us on the radio at 90.1 every Friday morning from 9:30 to 10.
Plugged In is produced by Brendan Rivers. Our managing editor is Alex Helmick.
Have a great weekend.